All right, let's dive right in. In this explainer, we're going to take a quick, focused look at one of the most high-stakes areas you'll ever face in nursing, acute and critical respiratory conditions.
I mean, really think about that for a second. When your patient can't breathe, knowing the difference between, say, a pulmonary embolism and pneumonia isn't just for a test. It changes everything you do next. A wrong turn here can lead to critical, life-altering delays. The clock is literally ticking.
So that's the big question, right? In an exam, or even more so at the bedside, the symptoms can look so similar and the pressure's just immense. How do you build that instinct, that rapid clinical judgment to make the right call?
Well, this is where so many students get stuck. It's this challenge of clinical differentiation when you're under the gun. It's about getting past just memorizing diseases and starting to truly see what's physically happening inside the lungs, in real time. Look, if you've ever felt that pit in your stomach, trying to figure out if you're dealing with fluid or an infection, or if you've worried about missing those subtle little clues that your patient is starting to circle the drain, you are definitely not alone. These are the exact hurdles we all face.
So this is where you need a mental model, a system to just cut through the chaos. And the framework we use at CSMRN starts with one really simple question. Is the main problem here an infection, a fluid issue, or a perfusion problem?
And check this out. Look at how this just simplifies everything. You hear pneumonia or TB. You're thinking infection. You hear pulmonary edema or pleural effusion. That's a fluid problem. And a pulmonary embolism, that's a classic perfusion or blood flow problem. This is your first step to getting clarity fast.
Okay, let's put it to the test. You've got a patient with a fever, a nasty cough, and signs of lung consolidation. Right away, based on our framework, which one of those three buckets does this fall into?
Yep, you got it. The fever, the consolidation, those are absolute hallmark signs of inflammation from some kind of pathogen. So you've just used the framework to nail down the core issue. This is an infection, and it's looking a lot like pneumonia.
Okay, but let's drill down a bit deeper. Inside that fluid category, there's a world of difference between fluid inside the lungs, down in the alveoli, that's pulmonary edema, and fluid building up in the space around the lungs, that's a pleural effusion. So the key takeaway here is location is everything.
All right, scenario number 2. You listen and hear decreased breath sounds, and the chest x-ray comes back showing fluid, but it's specifically in that pleural space. What are we thinking now?
Nailed it. That location, the pleural space, is the dead giveaway for pleural effusion. See what you just did? You didn't just say it's a fluid problem. You specified where the fluid is. That's a much higher level of clinical thinking.
Okay, so let's add the next piece of the puzzle, time. Once you know the type of problem, you gotta ask yourself about the urgency. Did this happen out of the blue, or has this been slowly building up?
And this right here is a classic distinction they love to test on exams. A pulmonary embolism, man, that's a sudden, oh my gosh kind of emergency. But an infection, like pneumonia or TB, that usually builds up over hours or even days. The speed of onset is a massive, massive clue.
So let's try it. You've got a patient, maybe they just had surgery or got off a long flight, and they suddenly get chest pain and can't breathe. That word suddenly should be like an alarm bell going off in your head. What's at the very top of your list of suspects?
Bingo. Pulmonary embolism, the sudden onset, the risk factor of being immobile, it all screams a blockage in a pulmonary blood vessel. A perfusion problem. You see how all these pieces are starting to lock into place?
Okay, now for the most critical part of all this. It doesn't matter if it started as an infection, a fluid problem, or a perfusion issue. They can all lead to the exact same catastrophic destination if things go wrong. We're talking about total failure. And that destination is respiratory failure. This is the point of no return where the lungs just can't do their job anymore. They can't get oxygen in, they can't get CO2 out. This is the ultimate life-threatening complication you have to be able to spot.
And this number, you got to burn this number into your brain. For what we call type 1 or hypoxemic respiratory failure, that arterial oxygen level, the PaO₂, drops below 60. This isn't just a little low. This is a clear diagnostic red flag of failure.
Okay, last scenario. Imagine your patient's oxygen sats keep dropping. You crank up the oxygen, you try everything, but nothing's helping. Their PaO₂ is in the basement. What is happening right in front of your eyes?
That right there, that is the definition of developing respiratory failure. Your interventions aren't working because the whole system of gas exchange is broken. Recognizing that exact moment is probably one of the most critical skills you'll ever learn.
So let's pull all this together. How do you make this a repeatable process, something you can rely on during an exam or a real-life code? Well, it all boils down to a really simple but powerful formula.
Here it is. It's a three-step process. First, you identify the cause: infection, fluid, or perfusion. Then, you recognize the urgency. Is this sudden or is it progressive? And once you know those two things, you can prioritize your response. That's it. That's the path to solid clinical judgment.
And that really is the whole point. This isn't about memorizing lists of diseases from a textbook. It's about training your brain to see the patterns, to understand the why behind the symptoms, so you can act with confidence when it matters most.
Because on your exams, and more importantly, in your career, being able to think this way saves lives. What you just saw here, this was just a quick peek. So the real question is, are you ready to go all in and master the entire framework?